being recorded. We kindly ask that you drop off the Zoom now. The webinar will be made available to the public soon. I'll give everyone a few minutes if you would like to drop off now.
I usually tell people too when their chart's inactive before I even talk to them. The one time I don't. Yeah.
All right, thank you so much. We'll go ahead and get started. My name is Hannah Brennan. I am a policy analyst with the National Indian Health Board, and I will be moderating today's webinar. Now, the goal of today's webinar and of this toolkit is to provide a resource for enrollment assisters and patient benefit coordinators to successfully enroll tribal members in Medicaid, both during and following the public health emergency. Today's content will focus on the Medicaid unwinding for Indian country in terms of the PHE ending, likely in the next few months. So we want to get a head start on how to adjust to the end of the public health emergency. Before we begin, we want to get to know a little bit about who is in the audience today. We will be using Poll Everywhere throughout this webinar to give everyone a chance to participate. My colleague will drop the link to join the poll in the chat now. All right, so that poll should lead you to Poll Everywhere software. And we are asking where you're joining us from today. In your browser, you can go to that link and click on your location on the map, and we'll all be able to see where you are calling in from today. Oh, that's great. It looks like we have a really good spread from all across the country. Thank you for being here with us today. Oklahoma, as always, has a good showing. All right. Thank you all so much for participating. And if you have any questions about the Poll Everywhere software, Carrie Field, my colleague, is great with that software. So just ping her if you need any assistance. Next, we'll be rating your level of familiarity with the Medicaid unwinding process. From novice to expert, we kind of want to get an idea of what kind of knowledge our attendees are coming in with today. I myself am probably an advanced beginner to maybe competent, so I'm looking forward to learning from our presenters today. Okay, it looks like we have a really great spread. All right, most of you are with me in that advanced beginner competent spot. So I'm sure we'll all be able to learn a lot from our speakers today. So I'm looking forward to this. All right, and it looks like our participants are understanding the Poll Everywhere software. So thank you for participating in these polls. I will now briefly turn to an introduction of today's speakers. Then I will turn it over to our first speaker to begin today's presentations. I do want to note from the top that once presentations wrap up, we will open the floor to questions. You can ask questions through the chat box throughout the presentations, or hold them to the end, and you will be able to use the raise hand function to do an audible Q&A at the end of the webinar. And now for our speaker introductions. First off, we will have Rajo Ortiz joining us from the Indian Health Service. Rajo is the director of the IHS Division of Business Office Enhancement in the Office of Resource Access and Partnerships. We will also have Kitty Marks joining us from the Centers for Medicare and Medicaid Services. Kitty is the director of the CMS Division of Tribal Affairs. We will also have Kristen Bitsui, who serves as the Tribal Healthcare Outreach and Education Policy Coordinator for the National Indian Health Board. She's been with the organization for 6 years, and she has extensive experience with IHS, tribal, and urban programs. Then we will have Tina Escobar and Kyla Hosteen joining us today from the Phoenix Indian Medical Center, and they will be presenting on their experience in the Phoenix area. Tina joined the benefits coordination team at Phoenix Indian Medical Center in 2016, and now serves as the patient benefits coordinator, as the lead benefits coordinator. And Kyla Hosteen also works in the center and serves as a benefits coordinator. And finally, we will have Sandy Seeley, joining us from IHS. She has served IHS for 20 years, currently serving as the Area Business Office Coordinator for the Oklahoma area. And without further ado, I will pass it over to Rajo Ortiz from IHS to kick off our presentations. Thank you. Over to you, Rajo.
Thank you very much. And Yate Bene and Kawatsi Halba. Thank you guys very much for joining the webinar this afternoon. IHS is very excited to be a part of this. We provide the cooperative agreement under which this toolkit was developed. That's the National Indian Healthcare Outreach and Education Cooperative Agreement. And we've been funding that, I think, for about a decade now. And just seen some really great work when it comes to outreach and education materials, webinars, and also healthcare policy analysis. Great work done by our partner, the National Indian Health Board. So I want to say thank you at the top of this for that. Medicaid and CHIP serve as a critical source of funding for care for American Indians and Alaska Natives. Over 1 million American Indians and Alaska Natives are enrolled in coverage, and many more were, and of course, many more were made eligible by the passage of the Affordable Care Act. Since passage of the Affordable Care Act, IHS has seen a significant increase in Medicaid and CHIP enrollment. And as we know, it is a significant part of IHS operating budgets. We had a total collections of about $1.67 billion in FY22, of which about 65% or just over $1 billion were attributed to Medicaid and CHIP. So it's a significant part of our budget. And in some service units, it's actually more than that. So it's very important that as the public health emergency comes to an end and the Medicaid redeterminations are being made, that states, that we make every effort we can to work with states and our other partners to ensure that our American and Alaska Native beneficiaries do not drop off of Medicaid unnecessarily. But if they are no longer eligible, we need to connect them with coverage that is affordable to them. We don't know when the end of the public health emergency will take place. So but the latest extension is effective through January 11th, 2023. I take a very cautious approach and say, that could mean that the 60-day notice could come very soon. So, it's very good that we're trying to provide these resources and get the word out there. We've been involved with this for quite a while. We sent communications out to our areas at the beginning of the summer. We've made presentations on our employee calls. We held a training, 2 trainings, one at the partnership conference that we had this summer, and we continue to work with our areas to make sure that they are following up on activities related to the unwinding. We also participate with CMS and tribes and tribal organizations on the CMS Tribal Technical Advisory Group, the TTAG, and we contribute to the conversation and about what is needed in Indian country to respond. We also did a data call for the on activities related to unwinding, and I wanted to share some of that information with you today. The questions focus mainly on efforts to communicate and exchange data with the state, coordinate with tribes, outreach efforts, and the use of resources and any barriers. Some of the areas reported that they are receiving this data, as you will hear today. Others are going to be making requests or have made requests, or they're using the CMS website, the state websites, and state-specific resources for outreach and education. And many of those sites are using those resources both in person and through social media. through robocalls, and using our PMS or the electronic health record system to identify patients that may be at risk of losing their coverage and following up with them. We asked about barriers. Of course, staffing shortages are always a concern. Returned mail, as we knew, would be an issue, or outdated contact information. We've experienced some, defensiveness or, about the renewal, and just takes education and talking to people and reassuring them that this is, for their benefit. And then also some Medicaid patients are getting care outside of IHS, so they're harder to reach. We asked if there was anything that could be added to the tools that were available. They talked about a possible video on Good Health TV or something similar to that could remind patients of the unwinding. Of course, text messages and social media messages, which we'll see today, are really important. And then, at any time we're trying to enroll people or attract people to public events, we definitely need to make sure that we have some items that, little things that we can give away and things like that. So, and finally, we are trying to make sure that we're staying up to date with our areas on all of their efforts. And we will be meeting with our areas next week. And this is going to be one of the biggest topics that we'll talk about. That's the end of my remarks. Thank you.
Thank you so much, Raho. That information is incredibly important as we transition into our other presentations. I do want to remind participants that you can feel free to ask questions in the chat. We'll either get to them during presentations or following in the Q&A portion at the end of the webinar. And now I will turn it over to Kitty Marks, Director of the CMS Division of Tribal Affairs. Go ahead, Kitty.
Thank you, Hannah, and thank you, Raho, for those remarks. Why don't we go ahead to the next slide, please? I'm just going to give an overview of what the Center for Medicaid and CHIP Services are doing to work with states and, of course, tribes and IHS and our urban Indian organizations to prepare for when the public health emergency ends. So after the public health emergency ends, states will resume normal operations. That includes restarting Medicaid and CHIP eligibility renewals, and they will be ending coverage for individuals that are no longer eligible for Medicaid or CHIP. And this process is known as unwinding. For about 2.5 years through Medicaid waivers and through congressional legislation, states have continued eligibility coverage for individuals. And those decisions were made because CMCS did not want individuals to fall off of Medicaid and CHIP coverage during the public health emergency when they needed health care the most. So as you can appreciate, because there has been continuous enrollment for basically since March of 2020, states have a significant volume of renewals that they'll need to take care of. And this will place a burden on state workforce and existing processes. So the CMCS Medicaid experts are working with state Medicaid agencies to make this as smooth of a process as possible. We have estimates that close to 15 million people could lose their Medicaid or CHIP coverage. And individuals may no longer be eligible for Medicaid or CHIP because their income has changed, their family household has changed, but we don't want them to lose coverage. We want to then have them transition to the marketplace and enroll in a qualified health plan or other health coverage. And so that's why we are working closely with states now. We're working within CMS with our partners at CSIO that operate the health insurance marketplace. And we want to work with you all, and we do work with IHS and NIHB to make sure that individuals do not lose coverage at the end of the PHE. So next slide, please. So the unwinding processes will vary by state. Each state Medicaid agency will have up to 12 months to start eligibility renewal. Normally, they renew eligibility once a year. That's under, outside of the PHE. But because there's been coverage for, like I said, the last 2.5 years, state agencies will renew eligibility of every individual enrolled in the program. And again, as I said, this is going to entail a large volume of renewals. There will be maybe some outdated mailing addresses or contact information. Many Medicaid and CHIP enrollees, beneficiaries might not have had any contact with their state Medicaid agency for the last 2 years. And so there are a lot of challenges ahead. And so that's, again, why we want to work with you so that we don't have individuals who lose coverage. Next slide. So CMS started working on unwinding activities back in March of 2022. We created a Medicaid.gov unwinding webpage, serves as a one-stop shop. This page is updated on a regular basis as new tools are released, new FAQs, et cetera. We encourage you to stop and visit this page for any updates. Next slide, please. What we have done on Medicaid.gov is a page where individuals, if they're not sure how to contact their Medicaid agency, perhaps to update their contact information, you can go to Medicaid.gov, you can click on your state and we'll have the Medicaid or CHIP information so that individuals can get in contact with their state agency for assistance or make sure that their contact information is up to date. And then again, here you can see that there's information about how to renew your Medicaid or CHIP coverage. So next slide, please. In addition to information on Medicaid.gov about the renewal process, we have also created a toolkit working with our Office of Communications. And this toolkit, again, because it is online, it's a living resource. It's updated all the time, but it really is very helpful for individuals who work with Medicaid or CHIP beneficiaries to help them help others renew their coverage. So next slide, please. So in this toolkit, we have developed tribal specific information. And these are examples of some of the graphics that we have created. And basically our message is, renewals are coming back. If you get a renewal letter, don't miss the letter. Make sure that your state Medicaid office has your current mailing address. If you're not sure how to do that, through the links that I just showed on Medicaid.gov, contact your Indian health care provider. They can help make sure your contact information is up to date, because we know that certain Medicaid individuals now are going to fall off Medicaid because they're not eligible for Medicaid any longer. But we don't want individuals to fall off Medicaid because they missed the letter, because they did not respond to that renewal form. So that's the message that we want to convey today. Next slide, please. And then in addition to those graphics, to make sure your mailing address is correct, we have created a tribal flyer that tribal health programs can update, either to include your tribal health program information, such as down at the bottom. If you have questions, you can visit. You can insert somebody's name. You can insert either their phone number or their email address. And then up at the top, you can add your state, such as the state of New Mexico. The eligibility reviews will start, July 1st, for instance. So we encourage you to go to, again, the Medicaid Unwinding Communications Toolkit. You can download the toolkit, and then you'll have to scroll down. It's a great big zip file, and then find this tribal flyer. And then you can fill this in and use it as needed at your outreach events or in your waiting rooms, etc. Next slide, please. And then, of course, many of you know that we publish public service announcements on a monthly basis that are played in tribal radio stations. This is the PSA that we published back in June. Again, don't miss this letter. Contact your state Medicaid office or contact your Indian healthcare provider for assistance. You can download these PSAs, post them in your local newspapers or display them in the waiting rooms. You're encouraged to go to our outreach and education website page here and download these PSAs and other outreach materials. Next slide, please. So right now, as Raho indicated, the PHE will continue until January 11th. A decision has not been made to whether the PHE will be extended or whether the Secretary will provide state Medicaid agencies a 60-day notice that he promised he would do before the PHE will end. So we're still in the phase, what we call of making sure that individuals' contact information is up to date. Some states are sending out renewal forms to make sure that the renewal form is returned. And we just want to get the message out that Medicaid unwinding will start when the PHE ends. And we just want to make sure that individuals, like I've said before, don't lose Medicaid or CHIP coverage because they missed a letter or didn't return a renewal form. So next slide, please. Okay, I thought we had some resources, but thank you very much for the opportunity to present. And joining me today is Wendy Hilt, who is the federal chair of the TTAG Unwinding Subcommittee. So both of us are available to answer any questions you might have, and we'll be here for the entire webinar. Thank you very much.
Great, thank you so much, Kitty. We appreciate you sharing all of those resources that CMS has available to us. That's really important to know what all is out there to help us through this transition. I will now turn the floor over to Kristen Bitsui, Tribal Healthcare Outreach and Education Policy Coordinator here at National Indian Health Board. Kristen, take it away.
Well, thank you so much. And I am so glad that you guys have made time to join us and be able to see some of the work that is being done at National Indian Health Board as well too. So next slide. So NIHB mission, we provide healthcare advocacy services. We also provide culturally informed tribal consultation support, preparation, testify before Congress, and provide timely information and other services to tribal governments. And whether tribes operate on their own healthcare delivery system through contracting or compacting or receiving healthcare directly from IHS, NIHB is their advocate as well too. So next slide. So with the public health unwinding, the whole talk around, what is going to be happening, what is going on as well too, and trying to make sure that we provide all the information there is out there. The Families First Coronavirus Response Act, which was signed by President Trump on March 18th, 2020. So this says for some conditions for states receiving enhanced federal Medicaid funding. And one of those conditions is that the state must not enroll anyone or must not disenroll anyone who was enrolled in Medicaid as of, or I think it's after March 18th of 2020, unless that individual moves out of state or is deceased or maybe requested to be removed from Medicaid. And this continuous enrollment condition is in place until the end of the federal COVID-19 public health emergency. And President Biden his administration indicated that they will provide states at least 60 days notice before the end of the public health emergency. And that's something that Kitty had just gone over as well too. Just making sure that you guys are also aware of some of these things that are coming down the wire. And this is the reason why we wanted to do this webinar, so that you have all of the information that you would need at hand. So next slide. So let's do a poll here. So we're curious to see how many American Indians and Alaskan Natives are estimated to be at risk of losing Medicaid coverage during the unwinding. So take a guess here and see what you guys think of how many American Indians and Alaskan Natives would be losing their Medicaid coverage. And this kind of just gives you an idea as you guys are doing this of what would happen, or what's that possibility. And sometimes seeing the number and visually seeing something there makes you want to also go out and do that outreach and education. So I'm just looking to see what those numbers are looking like here. And it looks like we're getting all the information coming in here. It looks like, oh, we're still at 54, between 156,000 to 162. It looks like that's the number that everybody is thinking. That's how many American Indians and Alaskan Natives are going to be falling off. Okay, are we done here? All right, here's the answer. So as you're looking at this, you realize that, oh my goodness, this is the number that we're looking at. And when you're wanting to see what that could be for American Indians and Alaskan Native, then you think, is this going to be, how many in my community is going to be falling off of Medicaid? And this is the number that we really don't want to see. And we want to make sure that, you know, we get to as close as zero as possible when it comes to making sure, because a lot of the revenue that comes into Indian country comes from Medicaid, right? So we want to make sure that we look at this and make sure that you're going to be going back and looking to see how many of those individuals are in your community, and to make sure that they don't fall off Medicaid. All right, next slide. So here we're talking about, we know that it's going to be happening. Now we want to move forward, and we want to make sure that in the process of doing that, we want all our tribal members to make sure that they understand what that could be for them. We need to also let them know when this is going to happen. So as we're preparing for it, we want to make sure that we let them know that they need to update their addresses, their contact information. I know that just even talking to some of the benefit coordinators out there and some of their people that they usually work with, you know, had to end up moving closer to a family member because COVID, or maybe other family members had to end up moving home as well too. And so different things have happened during this time that they had to end up moving. And along in that process, since they didn't have to do any kind of update with Medicaid, then they didn't do any of that process of updating addresses, turning in new income information, or just even, you know, if someone moved out, moved in, all of that stuff that you normally would do and usually on an annual basis, right? Or when something changes, right away, you go to the Medicaid office, or you go see the patient benefit coordinator, or, you know, a tribal enrollment assister. And so that's usually where they'll do all of that information. And so now we're trying to jumpstart and then tell them that, hey, we need to make sure that you get this done. And we don't want to end up having them sit on the phone for 2 hours trying to not renew, but to do a whole new application. because that's what's going to happen is if they end up getting disenrolled, that means that they're going to have to submit all the documents again. They're going to have to fill out all the forms again. And if we let them know ahead of time and they do get that renewal form in the mail, then it'll be easier to be, if some of the Medicaid office, what they're doing right now is they're pre-filling some of those renewals. So all the information is already there. Either they just, say, okay, everything is still the same on here. They sign that application, send it back, or going to the enrollment assister and letting them do it online for them as well too. So those are some of the reasons why we're pushing and we're trying to get this information out there to let everybody know the new process that's happening and to make sure that they understand that, okay, now you have to go back and do this updating as well too. So next slide, please. And we want to make sure that we are doing our part and making sure that we minimize that number. And as you just saw right now from the poll, we don't want that number. We want to make sure that a lot of our tribal members are being able to get that assistance, that they know where to go to, that they are also even aware that they will provide that information of updating. And how do you do that? What are you guys doing? And I've heard from several of you already telling me stories of what you guys have done to start being able, excuse me, start to help your tribal members, the community, getting that outreach, and also getting those messages out as well too. Where is that coming from? How are you doing it? And through these past, the public health emergency, during that time, you have also figured out how to communicate without even being there, without having to do it in person as well too. So a lot of places, they were doing Facebook videos. They were being able to do social media messaging as well too. And, being able to just get out there again and making sure that they understand and maybe continuing to do some of those messagings as well too that you did during this past time as well. So next slide. So communicating, how do we do this as we're going forward and making sure that they understand? And it's going to be a lot of education. And I'm sure there are still tribal members out there that have not gotten the information. They have not seen, or maybe they might not, or maybe they're just thinking, okay, well, yeah, all right, it's, the public health emergency got extended again. I'm not going to do anything about it. But informing them and letting them know that, you want to make sure that your current information is correct. What if you end up not, providing your address and it goes somewhere else, which would mean that you're going to end up falling off of Medicaid and not knowing exactly, what could happen with COVID as well too. So giving them examples, giving them tips, giving them some stories as well too, to let them know that, hey, this is the reason why you need to make sure you update your information, and letting them know that there's this eligibility changes that are going to be happening and they need to be aware of it as well too. So it's a lot of educating is what we're going to have to do, all the way from being able to do it from the rural side, all the way to the urban side as well too. So, wherever you're at, there's going to be different ways of doing this. And I always say that your community, how to communicate with your community as well too. Whether if it's maybe the rural side of it is, maybe they don't do the social media that well, but yet they see the newspaper, they know about the tribal radio, and those are some other avenues as well too. So, but a lot of making sure that they are aware of some of these things that are happening, and also utilizing some of those new changes that we had to adapt to as well too. So next slide. And some of these effective tools that have been used, and whether, as I mentioned, radio, newspaper, and there's places where they're utilizing texting as well too, to be able to communicate with their tribal members. A lot of our tribal members end up getting cell phone as well too, since the pandemic started. And those that started using email and different ways of the communication has happened through these past years. So just making sure that they understand. We also have Good Health TV that a lot of our facilities use as well too in the waiting rooms. So those kind of things are starting to happen. And also in-person outreaching is also happening. Meetings are being in person as well too. So there's all different ways of how you're able to continue to use some of those as communications. So next slide. And here I just want to get into some of the data that we always talk about. And so some of the unwinding data that we have come across. So Rochelle has been pretty phenomenal at pulling numbers together for us to see that estimate, to see the possibility of what it looks for us, because we're always trying to figure out, you know, so how many of our tribal members are going to fall off? How many American Indians and Alaska Natives are going to be falling off as well too? So next slide. So she produced this, these charts or these data. When she puts them together, they come from the Kaiser Family Foundation. And this one is from May 10 of 2022. And she always explains that these are estimates. So when you look at these tables, and you also, we're going to just show a few of them, but in the toolkit, you're going to see these tables as well too, and look at the state that you are in to kind of estimate and see what it looks like for your state as well too. So next slide. So when we're looking at this and we're trying to see, and when you look at the chart, it's going to give you, you know, the estimated Medicaid disenrollment. And it's letting you know, who's going to be losing Medicaid coverage during the unwinding process. And the two biggest categories when you're looking at these charts is going to be the adults 19 to 64, as well as 0 to 18. When we look at these two ages and we're thinking, okay, these two groups are looking like, we need to pay attention to them a little bit more. And so that's what I want you to pay attention to when you look at this. And you need to look at it to see like, okay, well, this is coming from my state. Now, what can I do to look in my system, or how can I run reports that I'll be able to look at these two groups and see what it looks like for my facility or for my tribal community. So next slide. So in this chart, you're looking at Arizona, Montana, North Dakota, Oklahoma, Washington, and then all of Indian country. And when you look at this, you want to see like, okay, so Kristen just said that there's going to be, individuals from 19 to 64 that are going to be falling off. And so when you look at the last column, you're going to look there, and Arizona is the one that's the highest, 10,587. And that's a lot. And so now you got to start thinking, okay, well, is this coming from my community? So I'm curious, if you have RPMS, there are reports that you can run between those ages and see how many of your tribal members will be looking at falling off as well too. But I always like to provide information like this. And I'm a visual person, so I always liked, well, how many though for American Indians and Alaska Natives? I want to see what that looks like. And so I start comparing that and looking at it and trying to see like, okay, well, let's go look at the Medicaid information for that state as well too. And what are they producing, or what are they providing as well? So it starts making me curious of why that could be. Is there something going on in that state that's preventing them? Or is there, what kind of challenges, what kind of barriers are there as well too? So that's what I start thinking about when I'm looking at these charts. So next slide. So when you look at all of that, then it made us think, okay, so we need to put something together that's going to be specifically for the tribes, for our enrollment assister. And I always say that our tribal community is extremely unique, and that our tribal members most likely will go to the clinic to get help. And that's where the patient benefit coordinators are at. That's where tribal enrollment assisters are at as well too. So going into all of that, this toolkit, we wanted it to be specifically and try to get as much information as possible to be able to provide for you as well too. And so, and a lot of times when we're looking for information, there's nothing out there that's specifically for the tribes. And so I'm looking here, I'm looking there, and I'm like, oh, I wish we could just put it all together and see, where a lot of these tools are at as well too. Sometimes they might not be specifically for tribes, but yet the information is extremely important. And that makes you think, okay, well, maybe if I produce this, and sometimes it's not about, inventing something again. It's about seeing something and then thinking, hey, this will work for my community if I put our community information in there as well too. So that's why we created the toolkit. So next slide. And in the toolkit, you will see, social media messages. You will see graphics that are specifically using tribal images as well too. Something that our tribal members will be able to see and be like, oh, hey, I see that rug. Oh, look at that pottery. And then when they're looking at it, they're going to see the messaging on there as well too. And sometimes that's usually the first thing they see is the picture, and then they want to know what it is and they'll look closer. So looking at, how we were going to produce this. And so what are we looking for? What do we want to do? And we looked at tribal designs. We also make sure that, since the communities are a little bit different, how can we make it customized for these enrollment assisters so they can use this? And so a lot of these things that we're looking at, and what is it that can be customized as well too. And we reached out to some subject matter experts. We also reached out to just random enrollment assisters out there, both on all three scales, IHS, the tribal side, the urban side, and seeing, what they're also needing, what they would like to see as well too. So we're getting ideas and feedback and, getting all this information together to see what we could be able to put in here in the toolkit as well too. But these are just a few here. So next slide. So here it's more about, we wanted to see when we produce this toolkit, what are going to be what's the reason why we want to do it? And so we started looking at it and making sure that, what are the takeaways that we want you to walk away with when you look at this. And so in this one, we thought, so if states do not proceed cautiously and American Indian and Alaska Native enrollees do not receive enough support for navigating these administrative processes, many American Indians and Alaska Native individuals may drop from Medicaid, even though they are still eligible. So we know that sometimes that, they do get the mail, but sometimes they don't open it. And so they need assistance. They want someone to help them through it. They want somebody to explain those kind of things to them. So that's why we thought, oh, that's one thing we need to make sure that our enrollment assisters have all the information they have on hand to understand. So next slide. And so the second takeaway from this toolkit is that due to postal delivery and broadband limitations, Indian healthcare providers can provide essential assistance with the eligibility and renewal process. So we know that some tribal communities were having issues with postal deliveries. And so, you have a whole family under one household, and that's also the same way when it comes to getting their mail. When they go to the post office, and you'll see, sometimes 10 names, and all those individuals are, getting their mail at that one post office box. And so, as well as some of the broadband, there's places where some of our communities didn't have that as well too, and those that limit them as well too. So we're thinking, okay, so, what do we need to do for them? What kind of information would they need as well too? And provide all of the information from eligibility to the renewal process. And so, those are some of the things that we thought of when creating this toolkit. So next slide. So the third takeaway is that many people will lose their coverage because they do not complete the renewal process. Though they remain eligible for Medicaid, others will no longer be eligible for Medicaid, but may be eligible for other affordable health coverages. And we know that, even though they complete it, or they might not complete it, or maybe there's something that's missing, and all of a sudden, they're without coverage as well too. And so we wanted to make sure that, okay, so if this is the case, then what do we need to have the enrollment assisters know about? What do they need to understand? And to make sure that they know that, okay, well, this is the guideline that came out, or maybe there was a policy that got changed, and what other guidances that might have came out afterwards as all too. So sometimes looking at those dates and understanding that will help you to know what you need to do. And we really don't want any of our tribal members, any of our American Indians and Alaskan Natives to end up falling off because they didn't complete their renewal, or they try to go back. And the thing is that, Kitty just went through her slides about how, some of the challenges that might be is that there might not be that many employees at the Medicaid office too. So that's where you guys all come in and working together and making sure that you are able to assist in that way as well too. So that is the end of my presentation. And if you have any questions at the end, we'll be able to answer those questions. Back to you, Hannah.
Thank you so much, Kristen, for that presentation. It was a lot of great information. And I just want to remind everyone to jot down her contact information right there on the screen, so you can reach out with questions following the webinar. I will now turn the floor over to Tina Escobar and Kyla Hosteen from the Phoenix Indian Medical Center.
Good afternoon. My name is Tina Escobar. I am the lead benefits coordinator at the Phoenix Indian Medical Center.
Or Tina, I think you are up now.
Can you hear me?
Yes, we hear you fine. We hear you fine, or we did.
Okay. Good afternoon. My name is Tina Escobar. I'm the lead benefit coordinator at the Phoenix Indian Medical Center. I have my team member, Kyla Hosteen, who will be providing additional information throughout the presentation. And I'm going to share our team's action plan for the Access PHE Unwinding. Access is the acronym for our Arizona State Medicaid program, which is Arizona Healthcare Cost Containment System. So the way our Medicaid program is allocated is through geographical service areas and counties. We are centrally located in Maricopa County. We're designated 7 healthcare plans that are available. Other areas are the north, which has 3 plans, and south, which has 4 plans. And I do have a slide if anyone wants to get that information, I can send it. So next slide, please. So each plan has an incentive initiative for the enrollees. We have the American Indian Health Program that is available for eligible enrollees who can receive services in an IHS facility. We do have the American Indian Medical Home, and that provides case management, diabetes education, care coordination, and that is through our primary care medical center. The managed care plans also have this available for their patients, and the plan availability is determined by the GSA and the county. Next slide, please. So this is an example of our AMI, we call it, our American Indian Medical Home listing. So the information provides demographics of the patient, including the access ID, first, last name, date of birth, age, home and mailing address, telephone numbers, and email addresses. It does not, however, have the health record number for our facility. So team members will have to look through and research that information demographically in order to compile that information. So some of the reports we get renewal notices for the month, and then also the total number of patients enrolled in the American Indian Medical Program. So our baseline total for the AMI program listing is 5,547, and that was the most recent listing received. So we have 12 team members that will split the workload of folding, stuffing envelopes, and sending the letter, which was reviewed and approved by our Office of Community Relations, and we'll do a mass mailing. So any return mail is going to be kept in a database, and we'll make alternative communication efforts to contact the patients, whether that's by telephone, text message, or email. Next slide, please. The managed care plans contact their patients regarding renewals and the public health emergency updates. Our team does not receive information on those plans. Next slide. So some of the outreach and education rollout that we have instituted with our Office of Community Relations is the robocall. So although the slide reflects that there's 32,000 plus, it's actually 42,000 plus in our database. So we will have the call go to all patients in the database, and that will then include the managed care plan enrollees. Next slide, please. This is an example of our flyer that we issue internally, and it provides a brief summary of what the public health emergency ending is, and it will provide what measures the patients can take in order to prepare for the ending of the PHE. And we have the contact information reflected for Healthy Arizona Plus, who is the processor of our access applications, and also for our team members. So we do have our cell phones and some extensions reflected. And next slide, please. So for the flyers, we have front desk screening staff. Those flyers are provided when the patients present into our facility, and they've also been placed in our clinics. We incorporated our application screening process, whether that be face-to-face or by telephone, to include information on the importance of updating the address, telephone numbers, and email addresses. So we do have other measures, which are the social media. We've worked with our Office of Community Relations. They've placed messaging on Facebook. Internally, we do have the Good Health TV. The message targets access patients and prompts them to update their address, telephone number, and the email address. Our PIMC website is provided within the slide, and we do provide information to the patients on how they can locate our contact information. So if you go to our PIMC website, look under the non-clinical area, it's benefits coordination, and you'll see a listing of all our team members. And next slide. So also for the patients that will no longer qualify for the Medicaid program, we are all certified application counselors with the Affordable Care Act, and we've initiated a protocol for us to follow, so that is a viable option for our patients. My contact information is listed, and Kyla, do you want to provide your information? I'm going to put it in the chat.
Yes, I'll go ahead and do that.
All right, thanks. And then if there are any questions that you do have at the end of the presentation, we can provide information at that point. Thank you.
Thank you so much, Tina and Kyla, for that presentation. As Tina noted, you all will be able to ask questions at the end of the next presentation when we turn to Q&A. Now I will turn it over to Sandy Seeley, the Area Business Office Coordinator for the IHS Oklahoma area.
Excuse me. Thank you, Hannah. And I'm glad so many of you could participate in the presentation today. I'm the Area Business Office Coordinator for the Oklahoma City area, and I'm representing the federal facilities in the Oklahoma area. We also have a lot of tribal facilities, but I'll be speaking just on behalf of the federal facilities in our area. So next slide, please. So we're very grateful in the Oklahoma area to have a good working relationship with the Oklahoma Healthcare Authority. They actually have a tribal relations department that works closely with ITUs in the Oklahoma area. We have bi-monthly tribal consultation meetings to address any issues and receive updates from the OHCA staff. We did ask the OHCA to share information on our American Indian and Alaska Native patients that were in danger of losing their Medicaid coverage at the end of the public health emergency. And they responded on around July the 1st and presented all the ITUs, or provided all the ITUs with a list of patients and demographic information and the reasons for loss of coverage. Next slide. So this is just a snippet of what that information looks like that was provided to us. I've taken out the provider numbers and identifiable information for the patients here, but what they provided for us was basically the patients' names, the county they're located in, the category that they're covered under for Medicaid, their race, their gender, and then also the reason that they're going to be losing coverage at the end of the PHE. So in our area, for the nine federal facilities that are going to be affected, there was approximately 1,500 plus enrollees that could lose coverage and receive service, that could lose coverage at the end of the PHE. So when we received these lists, they were distributed out. They were divided by the area that the patient's located in, and then they were distributed to each one of the healthcare centers to address each one of their lists. Next slide, please. We're also very fortunate here in the Oklahoma area that our local Medicaid, our state Medicaid office also has a toolkit. So they released the Unwinding Toolkit, and our sites have been using a lot of the resources for their outreach activities. And here's just an example of what one of those would look like. I believe this was one of the flyers that they prepared that we use a lot in our facilities to notify our patients about the renewals and so forth with sooner care coverage. Next slide, please. And this is another one that they shared with us that's in the toolkit that's available to us on their state Medicaid website. And so we've been using a lot of these materials in our outreach activities. Next slide, please. So they've done a variety of things within the different facilities in our area, the patient benefit coordinators and the facility staff. They've done social media posts, they've done mail outs, flyers, postcards, letters. They've also had audio care calls, phone calls, brochures. They've participated in outreach activities at tribal events and community events. Some of our facilities have attached flyers to pharmacy bags, and then also public service announcements in tribal newspapers. And so those are some of the activities that they've done to address trying to get the word out. And this is all in addition to the screenings that they do in their facilities on the daily basis of the patients that are coming in. All of our Medicare patients our Medicaid patients are being screened and updated, recertified if eligible, and so forth. So this is just extra things that they're doing in addition to their daily activities screening through their patients. Next slide.
That's the last slide we have.
Okay. Yeah. And so that's, they just wanted me to share with you a brief of how the state shared the information with us, and then, what our activities have been going forward. So they're all working their list. I believe all of the patients on their list have been notified with one of these outreach activities, mostly through the mail outs and the postcards and the audio care calls. For the ones that did get returned, and they're making extra efforts to contact them by phone and things like that for the return mail. But we are working with the state. They have talked about sending us an updated list. Our current listing was through June of 2022. So we know that there's others that have probably met that criteria to possibly drop off. So they're talking about sending us an updated list maybe at the end of December, early January, or even earlier, so that we can make sure that we're reaching out to all of those that may have, that may be in danger of dropping off between June and the current time period. So that's all I have. And I'm Sandra Seeley, and I can share my contact information in the chat.
Thank you so much, Sandra. That's great information to share. I want to thank all of our presenters again for providing such important information for our attendees today. Before we move into the Q&A portion of today's call, we have a couple more poll questions for all of you. So this next question, how confident are you that your state is well prepared for the Medicaid unwinding and the end of the public health emergency. Okay, we see a lot of concentration in the middle there, which is expected. Oh, a few in the dark green, that's good news. All right, thank you for sharing that. It looks like a lot of yellow, maybe a little better than moderately confident. So thank you for sharing that. Moving on to one more question. What are you most looking forward to using from this Medicaid Unwinding Toolkit? Another way of asking that, what do you think will be the most useful in your work in your communities? Okay, we see a good spread. I know social media has been extremely useful lately, especially with the public health emergency. So I'm not surprised that social media graphics are kind of up there. Right, and the importance of the redetermination crisis and avoiding that as much as possible. Great. Well, we really look forward to seeing how these resources can be helpful to all of you in your communities in addressing the unwinding. So thank you for your participation in these polls. It's really helpful, you know, just to keep the audience engaged and to see where you all are at in how you feel about the public health emergency. So thank you. I will now turn to our question and answer portion. I do know there were a couple questions left over from throughout the presentations. So I will open this up to our whole panel of speakers today. One question from Jolene White from earlier was, what outreach avenue did you find was best to reach out to tribal members or elders? And I will just copy that into the chat. And I welcome all of our speakers to respond if they have an answer.
Yeah, I believe she sent it during Kristen's, but I was wondering if the speakers after Kristen might be able to answer, as well as her follow-up question about RPMS as well.
Absolutely, great question. So some of the things that I've been hearing when it comes to doing outreach is a lot to do with social media. Social media more in the urban section. And then in the rural side of it, it's the tribal newspaper, and tribal radio has been pretty huge when it comes to reaching elders and being able to also give them the information of when you're available and how you're available, and as well as being able to let them know, hey, this is coming up on the horizon. You need to be aware of this. If you want more information, come see me. And the thing about social media is that you want them to contact you. So you don't want to put too much information on one graphics or even in the caption. You don't want to put too much on there, but enough to let them know that, you know, this is what's going to happen and you can reach me if you have any questions. And that's basically how the social media site has been working. And with the radio side of it, it's, as Kitty had mentioned, some of the CMS PSAs that they have produced as well too, that they've been utilizing on the radio side of it. And also putting your information out there so that they're aware of that. But yeah, that's a really good question. And Rochelle, what was the other question? Or actually, you know what? I will open it up to our other presenters as well too, if they have any comments on that question.
Hi, this is Raho from IHS. We did in that data call, we asked our areas about resources and methods of outreach that have been the most helpful. And they indicated that patient registration at the front desk has been providing reminders to patients that check in that renewals will be coming. So as they walk in the door and have an appointment or seeking care. And then the benefit coordinators are providing information to patients during their appointments or when they have walk-ins. A lot of sites are, of course, I mentioned, are using those flyers that have been made available by CMS and the states. Health fairs or coordination with tribal events as well. And then some sites are using social media, local radio and local newspaper. And then, as I said before, all the sites are using RPMS reports with the data they have to follow up. Thanks.
And actually, and Raho, and anybody else, feel free to, but there was a question specific to the RPMS reports. When running the report from RPMS, we ran a report with patients who have Medicaid. Can you suggest any other stipulations? I don't know if Jolene, you feel like that might have gotten answered with the two presenters after Kristen, because I know you put that in the chat during Kristen's, but you know, because they showed kind of their examples. But if anyone wants to answer that question.
I would ask that one of the areas talk about that.
Sandy?
Yeah, I noticed Sandra said she'd get information to her, but would you like to say anything to the whole group?
Well, as far as the reports that you run of RPMS, the PORP report might be the best option to help you identify some of those patients. But honestly, without knowing the eligibility dates, and since no one has been termed, I think it'd be very difficult. It's hard using the RPMS reports to identify the ones that will be dropping off. I know that's our best tool available in RPMS, but I really think you need to work with the state and try to get that list from them of those patients that are going to drop off. And that's probably the best way. But I mean, running that report in RPMS is your best option with an RPMS report. And I don't know of any other options. And if anybody else maybe could that's participating, if you can write in the chat box if you have a better experience. But as far as an RPMS report, just the Medicaid eligibility would be the only one I would know to run.
Thank you for that.
So this is Tina. We suggested to our sites to run a VGen report for the past 2 years for our Medicaid patients. And so those are reports on active patients that are actually we're seeing within the facility, because then you can pull that to VGen report by state, or state driven.
Thank you for that, Tina. Mm-hmm. And then Kristen, there's also a question here. So if a Native beneficiary is under a Medicaid managed care plan, is there a process in place with those MCOs or with a state to ensure Native beneficiaries are made aware of the unwinding? That was from, I believe it might be Lisa. I apologize if I say it wrong, Lisa Shaw.
So each state does their things differently. So depending on how they get in contact or how they're doing their outreaching from the state level is all different as well too. And Wendy, by any chance, are you able to help with that question from the CMS side?
Hi, yes, this is Wendy. So I think what you said, I would just kind of piggyback on that. It's dependent on states. What I can do is also take down, Lisa, if you don't mind emailing me, I can also do a more extensive look and get back to you via email. So please, if you're comfortable, share your email in the chat, or you can email me directly, and that's Wendy, WENDY .hilt, HILDT @cms.hhs.gov. And I also put that in the chat. And I would be able to work closely with you to get a response depending on the state.
And I did want to point out that in the chat, early on, there were, Wendy had also put the information about the CMS toolkit, both the link to the graphics and the link to the toolkit, and answered a question about that you can print the letters and documents. I just wanted to make sure everyone saw that. And then we, as well as Wendy, put a link to our toolkit in there. So we wanted to make sure everyone saw that as well. So hold on, now I've got to go further down the chat again because there's been some stuff that's come in. It looks like mostly just thank yous. And I know I see now that let's see, I see now that also Jolene had asked Sandra for the audio care, sharing the script, and that's what you were exchanging emails about. But so I think we don't have any more questions. But yes, feel free to use the raise hand function, and then we would love to hear if anyone else has any more questions.
Rochelle, I think that there was a question about American Indians, Alaska Natives who might be enrolled in Medicaid managed care. Was that question answered?
Let me see.
Yeah, Kitty, I asked for email for more contact, but if you have a more general answer as well, then please feel free to answer it.
Okay, yeah, because I think it's critical.
I can put the question back and let's see, it's gotten buried here, but I can find it again.
Yeah, but I think I can. The question was whether somebody enrolled with Medicaid managed care, what's the process for MCOs to make sure
how they're being made aware of unwinding.
I just stuck it back in the chat too at the bottom.
Right. So Medicaid managed care organizations have the ability to provide notices to those enrolled in their Medicaid managed care plan because they signed up for the plan. They have the best contact information. And so they will be sending out information to those beneficiaries as well to make sure that the beneficiaries are aware of the unwinding. And because of that unique contract that Medicaid managed care plans have with the states, the MCOs have that ability to specifically reach out to their beneficiaries. Of course, the state has to send out the renewal notice or the redetermination notice, but MCOs have that ability. And so that's why we encourage, Indian healthcare providers to reach out to their beneficiaries. And that's why we've encouraged Medicaid state agencies to share data of American Indian Alaska Native beneficiaries that receive services through Indian healthcare providers on the fee-for-service side so that the IHCPs can reach out to the beneficiaries as well. I think everybody's on the same page that we want to reach beneficiaries and let them know that Medicaid unwinding is occurring. So thank you.
Thank you, Kitty. Sorry, I was navigating the chat and didn't see your message. And then Jolene just put in the chat too, this is all new to our tribal community and staff. Can you assist me with who or how to contact for the state of New Mexico to assist with obtaining data? I don't know who that question is directed to.
I see. Oh, sorry.
Okay,
I was just going to say that Tina Valencia was able to share Teresa's contact information for you in the chat. So she is the lead tribal liaison in the state of New Mexico, and she is pretty awesome. So she would be the one to talk with. I'm not aware of if in New Mexico, if they're sharing data as well too. But that's the reason why we invited Oklahoma and Arizona, because since they were doing it, other states and other tribal communities and other IT facilities are also asking, how did they do it? Or how was this process that happened for them? Because there are still other states that have not shared that data as well too. So that's the real reason why we're trying to see how we could do this webinar and what kind of information we can bring to you, and then to also be able to have you hear it directly from these two areas so that they can share with us exactly how they're getting the data, how they're utilizing it, and how beneficial it is for them as well too. But yeah, so Teresa from New Mexico, that is her contact information, and she is the lead tribal liaison for New Mexico.
And it looks like there's now a similar question for Washington. So I'm wondering if there's a website where they can find out who their, who their person is, their equivalent of the New Mexico person for Washington. Stephanie Wilson is asking.
Yeah, this is Kitty. I'll jump in. On most Medicaid state agency websites, they'll have the tribal liaison listed. But if you need assistance, CMS has a Native American contact that's a CMS employee. And that Native American contact is the point of contact and is assigned to each respective IHS area. So for the state of Washington, that Native American contact is Justina Redlinsky. And maybe, Wendy, you could find the list of the DTA NAC list on our website and put that in the chat. But if you ever need assistance in information around state Medicaid information, the Native American contacts at CMS are a great resource. So
just to add to that as well too, the more I'm working in this field and understanding, who those contacts are within the state Medicaid side of it. And what I found out is that, so there's sometimes in the state, there's just like New Mexico has a lead who is able to answer a lot of the questions. And then each plan also has a tribal liaison as well too. And so depending on the state, you'll find that, there's tribal liaison specifically for a plan as well too, which was kind of interesting for me as I am looking at this and researching and understanding a little bit of how state to state, how it works as well too. So even with the behavioral health side of it, there's tribal liaisons for that as well too. So just a little bit more information there.
Yeah, so this is great. Thank you. Hannah put in the specific to Washington, and Wendy put the whole list in for all the IHS areas. And then we also have the other information. So I want to circle back so we don't lose it to a question from Yolanda. How long does AHCCCS direct line reflect information when a patient reapplies? Are they renewed for only several months?
Okay, so access direct line. I want, maybe I should have Tina answer this, or maybe both Tina Valencia or the other Tina Escobar.
Calling one of the Tinas.
Here, I'm not sure, but I know that they can actually log on to the eligibility website and take a look at that information. But I do know if they have any questions, they can definitely go to their business, whatever service unit that they're being seen at, and talk to the business office the benefits coordinator and ask them. So they should be able to give them an update. And Tina actually replied, she is a benefits coordinator, and she says the access renewal is usually 1 year, normal process.
Yeah, and I believe that their online portal is in real time as well too. So when they do update their information, then it reflects immediately as well too, unless if it's something to do with income or something like that. But from what I saw from the address side of it, or update contact information, you can be able to, that reflects right away. But and they can do that at any point, at any time. You know, let's say that maybe today they change it, and then tomorrow they might have a different address again. They can go back in and update it as many times.
And Kristen, I just want to make sure it's not really a question, but there was a comment from Kyla, one of our presenters, that you may utilize iCare to create a panel for those enrolled in Medicaid in place of RPMS. So that's just a helpful piece of information I wanted to make sure we didn't lose. And now it's in the recording. And so Julie just provided that South Dakota does not, or was not able to give us a list. And that's interesting information, as well as I believe somebody else said something about that they're from New Mexico and haven't gotten any information from their state yet. So that list of tribal liaisons is helpful. And Hannah put another piece of information in the stat chat for Washington. I think I've gotten all the questions. If I missed one, please either drop it back in the chat or raise your hand. We're happy to listen to you, so we're not doing all the talking.
I did see the message.
It is 3:30 too. Oh, sorry. So Tina, gave us a little more information here in the chat. Yeah, C19 process. Disclaimer indicating continuing coverage due to COVID-19 is reflected. Usually means patient is over income limit for Medicaid. So thank you, Tina, for that information. And I do also see, Kristen, that it is 3:29. So we're doing really well here.
Awesome. Well, we thank you so much for joining us, and also the discussion. Thank you for that, and just hearing and listening to all of you as well too. And it helps us to know what we need to do on our end to do the advocacy work and to provide as much information as possible too. And, you know, the feedback on the toolkit, you know, we're always looking to see what we can do and to improve as well too. Something that works for the tribal community, something that you might be able to utilize. We're always wanting to hear that information. The feedback is going to be tremendous in this. And let us know what's going on in your community as well too. We want to hear the stories. We want to know, you know, what's going on. As you know, South Dakota just shared that, you know, they're not receiving any kind of data information as well, and they're not sharing it with them. Those are some of the things that we want to hear and understand, and maybe find out exactly why that is as well too. So I'm very thankful for each and every one to take time out and join us. And hopefully this toolkit will be extremely beneficial to you. And there's a lot of information in there. It will take time to review. There's links in there. So right away, you'll be able to look at some of the information that we have put together as well too. And so Raho, Kitty, do you guys have any closing remarks at all?
This is Kitty. No, great presentation by everyone. Great questions. And I'm glad I was part of it. And CMCS is always here to help all of you as we prepare for Medicaid unwinding. So thank you for all the work that you all do out in the fields. Thank you. Yeah.
Hi, on behalf of IHS headquarters, I just want to say thank you very much for inviting us, and thank you for the hard work that the National Indian Health Board has put into this toolkit. And thank you to our IHS colleagues for joining the call today. And congratulations to South Dakota for expanding Medicaid. Thank you.
And right back to you, Hannah, to close us all out.
Thank you, Kristen. Yeah, just one more thank you to all our attendees and all of our presenters today. A reminder that today was recorded, and this recording will be available to you on NIHB's website with the other unwinding materials. So thank you all again, and good luck out there. Feel free to contact us with any follow-up questions. Have a great rest of your day.